Welcome, 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 welcome. It is time for Veteran Nexus Letter Live. My name is David Geier. I am your host. I am a triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters, performing DBQs, and some other type of work to help you get the compensation for your orthopedic injuries and conditions, the compensation that you deserve. Very, very excited to be here. This is your chance. Once a month I do this live, free-for-all type discussion, ask your questions about Nexus letters, DBQs, the claims process, but more importantly, about certain injuries and can that be claimed? Can that be considered secondary to this? That type of thing. This is your chance to ask, and I hope it's helpful. I am not trying to promote my work by any means. I am happy to talk to you about that either now or off after the show or other times, but this is really to help you. Maybe you're not even necessarily looking to file right away, you're just looking for more information. So like always, and I've done this 3 or 4 months now, I like to do this for people that as sort of my giving back. There's no obligation or anything like that. That is just my opportunity. A couple things that we get started. Leave your question if you have one in the chat, not in the comments. I cannot see the comments. I am on a software called eCam. I'm not actually on YouTube, and so only the chat gets sent over. So that is, I think, on the right side of the screen if you're on a desktop, not sure on the phone, but not in the comments. I will not see that. Also, this is not in any way meant to be medical advice. I haven't seen you, haven't examined you, looked at x-rays, MRIs. I am not giving you medical advice. Nobody can do that online if they don't have a license in the state where you are. So this is meant for general information and educational purposes only. I am not affiliated with the VA. I'm not a CNP examiner or anything like that. So if you have questions specific to them, obviously that you need to find that person. I'm also not a VSO. I think VSOs can be very helpful, but I can at least help with the medical part of disability questions. There is Mark Shippey. Very cool logo. Very impressed with your avatar. You are very welcome for your Nexus letter, Mark. Super, super guy. I'm going to read this. I've had a long day, so I need good news. Thank you for your incredible work and support. Nexus letter gave me the hope and strength to keep fighting for my VA claim. I truly appreciate everything you and Jennifer have done. That means a lot. I very, very much appreciate it. Also, and I think it's you. I'm going to be embarrassed if it's not. Was just checking my email like 5 minutes ago, and I got a message from Google that you left a 5-star review. Very, very thankful for that, Mark. I love veterans for a whole lot of reasons, but the service to the country, just so much. But also, some of the most grateful people ever when I work with them, and that means a lot to me. It's really great. So you are very, very welcome, Mark. If I can ever help in the future, certainly reach out. All right, Wash Engineer, very cool. I'm curious there's got to be more to that story. Can you talk about the differences in semi-related foot conditions and how they're rated, evaluated, pes planus versus plantar fasciitis versus Achilles tendonitis versus posterior tibial tendon deficiency? All right, there is some variability here. So I'm going to tell you what I have seen in rating decisions letters since I've done this. Let me preface this by saying, I don't know the number, somewhere 75 to 90% of the veterans that reach out to me wanting help with the condition, they've already been denied for that condition by the VA before they reach out to me. So I have read way over 1,000 denial letters. I mean, easily. And so there is a lot of variability. Most of the time, the VA rolls, say, right foot disorders, whether it's flat feet, plantar fasciitis, all into one rating. I have seen veterans that somehow managed to get it pulled apart, not for different things, but like flat feet, and then they also got something else, and that's not the norm. So I don't want to say that it definitely is. The feet is sort of tricky as far as the ratings go because they put so much stock into the pes planus and the severity of that, and is it bilateral, that some of the others don't really get much attention. If you look at, say, the shoulder or the knee or some of these other body parts, even to a lesser extent the neck and the back, so much of the rating is dependent on range of motion during either the C&P exam or the DBQ that you have a private person do. Whereas the foot, it's not as much range of motion as pronation of the foot or abduction of the foot in the case of pes planus, flat feet, or something along those lines. But that's a long answer of saying most of these conditions are tied together as all one rating, right foot, and then tied together as a left foot. But there, I think, are circumstances where that can be different. Just I haven't seen that very often in all those ratings letters. You are so welcome. And he says he'll keep me updated. That's the other thing. And I will warn you now, Mark, and I say this to any veterans I work with. This literally just happened. I was reading this email like literally 2 minutes ago. That I set, so when I finish a Nexus letter, I set a reminder in my calendar to check in, usually 3 to 4 months, depending on how long I just think it might take for that to go through. And, hey, follow up, check in and see if you won, because, you guys are busy. You may not remember to let me know if your claim won or lost, so I check in. But I am really bad about if you find out before that and then let me know. I forget to cancel my reminder to myself. And so then I'll say, oh, I forgot, I need to reach out to him, even though you may have just reached out to me 2 weeks before telling me you won. That literally just happened a few minutes ago. A guy's like, I just told you last week that I won. It's just because I forget to turn off the reminder, but I do want to know. I really wish more veterans would just spontaneously let me know they won, they lost, whatever it is. I'm always curious too about the denials, because the first thing I want to know if a veteran lost after working with me is, did they include my Nexus letter, my DBQ, if I did a DBQ, in the evidence? Did they actually read it? And it is stunning to me how often they didn't include it at all. It's not even listed in the evidence. And that may be how the veteran filed it, appeal, all that, that type of thing. But then it also makes me wonder, like, are they just relying on the prior denial and nothing else? So that's always one of the things, the other reason I like to follow up. Anyway, sorry, long rant. You are more than welcome. I hope that was helpful. More people have given me insight, because it's bigger than just the foot. There's a term called pyramiding, where you have, say, one condition, let's just say lumbar strain, lumbosacral strain, a muscle strain in the back, and then you end up getting MRIs and this, and you refile and you get it as now lumbar spine, say degenerative disc disease, facet osteoarthritis, spinal stenosis. All of that is going to go still into the lumbar rating. They'll just change what it's rated for. Hopefully the rating increases, depends on the exam again, but they don't give you, all right, we're going to keep your lumbosacral spine and now give you these other ones, and then all of a sudden you've got 2-3 different back ratings. That's not how it works. And so that's where it can get a little tricky. Now, there are evidence, there's one I want to use as an example, but he just reached out to me today, and it's such a rare condition that I don't want him to, even though I wouldn't use his name, but it is an ankle problem, and then a problem that developed around the ankle that's not an orthopedic ankle diagnosis. That one could be a secondary, a separate rating. So it's not absolute in everything, but that was my long answer to the foot pyramiding, so to speak. All right, how intern hustle. Everybody's got cool names today. Mark, you're an exception in that you're using your name. Intern hustle. How are patellofemoral pain syndrome, chondromalacia patella, and patellofemoral osteoarthritis related? And you are very welcome for answering questions. All right, so I'm going to leave this on the screen for people to read this. So I have had chondromalacia or patellofemoral pain since I was probably 13, 14 years old. I get it. I know it. It was miserable in college and in high school and college until I finally mostly got over it. Chondromalacia is what we used to call it. It's more technically patellofemoral pain, but it's the same thing. They're not separate. We've gotten away from the term chondromalacia because technically that means softened cartilage, but you can have pain under the kneecap and in that area, the patellofemoral joint, without having the softened cartilage, and that's why patellofemoral pain is the better term, but they are the same thing. They're not two different conditions. Now, the patellofemoral osteoarthritis is what very often years down the road that becomes, that you get a breakdown of that articular cartilage in the patellofemoral joint, under the patella or in the trochlear groove of the femur. It's one of the three compartments of the knee. There's the medial compartment on the medial or inside of the knee. There's the lateral compartment, and then there's the patellofemoral compartment under the kneecap, trochlear groove of the femur. Now, don't get worried. Patellofemoral pain doesn't routinely become patellofemoral arthritis, but it can. And military and athletes, my sports medicine background, those are people that it a lot of times does. The people really at risk for patellofemoral arthritis are people with a history of patellar dislocations, where the kneecap just over a number of years just kept popping in and out of place, and it just damages the cartilage of that joint, and eventually it becomes arthritis. But jumping athletes, climbing athletes, they are very much at risk for that as well, especially if they had patellofemoral pain. But that's what that is. Let's see what else. Mark says he's getting a letter from his community care provider. You know, it's funny, and I have no issue with that. It is interesting. So I am a big believer, and I probably told you this, Mark. I usually tell most of the people I work with, the more information, the better. There is debate, I will say, among what I've seen online about people saying, can you have too many Nexus letters? Like, if you have 2 or 3, is that more harmful than just 1? And that's a tough, I don't know that there's a right answer from that. The upside of, if your orthopedic surgeon will write one, big fan of that. If they were the one treating you, the problem with that is, unless you're like in a regenerative orthopedic practice like I am, where you have complete control of your schedule and can carve out half days a week to do this kind of thing, when you're seeing 50, 55, 60 patients a day in clinic or doing 5 to 10 surgeries, you don't have time to write quality Nexus letters with sources and all of that. So I don't know any orthopedic surgeons doing it. Maybe though, I see a couple, veterans that get denied, and they send me their stuff, and they have Nexus letters from their orthopedic surgeon. It'll be this half-page thing that's just not helpful at all. But I don't know anybody that's doing well-researched, well-written ones. They just don't have time. Now, primary care, that may be a different story, but I disagree with the people out there saying that you can have 2 or 3 and it may be harmful. If your doctors that took care of you will write one, I am a big fan of that. It's just that's not very normal, especially you won't get the VA providers to do it. If you've had a VA provider write one on your behalf, let me know, because that would be the first I've ever heard of that. But having said that, in the private healthcare world, if they'll write it for, I'm a big fan. It's not that common, and that's where that comes from. All right, that may be all that we have, and that is great. I stay until we run out of questions. That's great. Mark, thank you for your kind words. All of you, thank you for your questions. If you do, and again, I'm not promoting my practice, but if you're interested in learning more about it, there's a link where it'll take you to 2 things. One is, if you go all the way down the page, you'll read more about the process of working with me and what I do. But more importantly, at the top of the page, there's a free ebook that you can get. I told you how many what percentage roughly of the veterans that reach out to me have been denied before they reach out to me. And again, I'm guessing it's easily 75%, easily. So I have read hundreds and hundreds and hundreds and hundreds of denial letters. And there's a handful of common reasons that they deny. And it's good to know those, so you can look at your own evidence, look at your medical records, look at your service treatment records, look at your case, and see where the VA may push back. And so I wrote a free ebook that compiled all that information. I'm going to be working on a revision to that here coming up soon, but you can get that absolutely free. Just go to the link in the description at the top, click on it, name, email address, it gets sent to you in about 5 minutes, and it's like 40 pages, and it's helpful information. And again, there's no obligation to it other than you get more information about it than you can get. Mark asked, do I write about... So the answer, yes. I don't want to ever commit to any one thing. Somebody reached out to me with a toxic exposure one earlier today. I will consider I try to focus on orthopedics, but I will do non-orthopedic things. It's just they take me a lot more work, a lot of research to get the studies and that kind of thing, but I will do that. The closer it is to orthopedics, the more certain I am that I'll do it. So chronic pain from neck and back stuff, that's right up my alley. But when you're talking toxic exposure stuff and things like that, I'll sometimes do it. I tend to give myself a little more leeway in how long I take to do it because the research is a lot harder for me. It's just not my area. But it just depends on what it is, and that's where I say I need to see the records, kind of see what the case is and things like that. But certainly can help that. Do I do hearing Nexus letters? I actually just did one. I won't say a name. One last week actually. I don't do a ton of those. I tend to only take ones on where I feel like I can help, meaning there's clear diagnoses in the records and clear arguments for, usually it's noise exposure. But if I can feel like I can make a good case, yes, I'll do it. I don't do tons of it, but if the evidence is good, I'll usually take that on because I want to give people the best chance of winning. Would you suggest having a Nexus the first time you file for secondary? Is feet causing knee problems? All right, that's a great question. And I'm going to end on this because I don't want to just ramble on and on. Secondary conditions, in my experience, win very frequently, except the problem with secondary conditions. You've got to remember, most of these C&P examiners, there are some physicians that do it, but it's usually PAs and nurse practitioners. I have no issue with PAs and nurse practitioners. I've worked with them my whole career. They're fantastic. But the C&P examiners very, very, very frequently have no background, no knowledge of orthopedics other than just doing these C&P exams. And I have seen so many denials that have happened before they reach out to me of very logical things. Right knee arthritis argued as secondary to left knee arthritis, denied. There's no evidence that happens. If you asked 100 orthopedic surgeons, 100 orthopedic surgeons are going to tell you that's nonsense. We see it, tons every day. Secondary conditions, you need somebody that is an expert in that area to argue it because it's very easy for them to say there's no evidence of cause and effect. And if you don't have evidence to argue against that, Nexus letter with studies that show it, a lot of times it loses. So a well-written Nexus letter, it usually wins, assuming it's not weird attempts at secondary connections like I've talked about in some of these before, trying to argue neck caused by a knee injury, something like that. But something like knee, foot problems that caused a knee issue, if you've got an orthopedic surgeon that will write it and have studies to support it, that usually wins. If you try to file that on your own without that, there's a good chance it loses just for that reason. It's just too easy for them to say there's no evidence, and if there's no counter argument to that, they sort of get away with that. And that's I'm not saying that they're trying to screw you. I just think that they don't know the orthopedic journals and the studies out there. Why would they? And so you want somebody to represent you on that, in my opinion. You can take that for what it's worth. That's just what I've seen. Again, it's reading so many denial letters. That's just what I've seen. Meniscus tear secondary to service-connected plantar fasciitis. That would be tough. I'd have to know more of the records. The reason that would be tough is trauma. What you want to address in secondary conditions are degenerative conditions that resulted from it, meaning like arthritis of the knee secondary to a foot condition. If it's like what would not work would be a muscle strain secondary to another condition, some traumatic event. There's circumstances that could win, but what you want to show is that one condition caused increased stress on another part over a long period of time, and that leads to a chronic degenerative condition. Now, meniscus tears can be degenerative meniscus tears for sure, so it depends a little bit of the specifics. But like somebody tried to say and to ask me about an ACL tear secondary to the back. There is no chance. I mean, there probably are ways to argue the back caused some muscle weakness and all, but that would be a very tough argument. Traumatic injuries as secondary are hard. Degenerative ones are a little bit easy. There are exceptions, and it really depends on the records and the specifics of the case. That's my general rule of thumb about that. Daniel, I hope that was helpful. So, all right, that is all I've got for you. Very thankful that you were here. I hope this was helpful. Next month, it's going to be a week later. It'll be on September 8th because September 1st is Labor Day, and you don't want to be, you want to be at the pool or beach or somewhere, not on YouTube watching me. And honestly, I want to be at the pool and not on YouTube. So we're pushing it back to September 8th. Tell your veteran friends about this. Again, there's no obligation. This is a completely free show. I just want to give you information, even if you never work with me. That's perfectly fine. But very, very thankful. Daniel, you are very welcome. Wash Engineer, you are very welcome as well. Reach out anytime. But thankful you're here. If for any other reason, I will see you Monday, September 8th. Keep an eye, subscribe to the Veteran Nexus Letter channel. I release videos every week there as well. But very, very much appreciate you, and I will see you very soon. Have a wonderful, wonderful rest of your day.